Well, as Canada's vaccine rollout surges forward, health authorities across the country are grappling with the question of how to combat vaccine misinformation. As research has shown, it's everywhere. A recent StatsCan report found 96% of people who use the web to learn about COVID found info they suspected was misleading, false, or inaccurate. Almost 70% of those saw it at least once per week. Over half shared COVID info without knowing if it was accurate, and more than a third of people verified their info only sometimes or rarely. So how can you spot this kind of misinformation, and what should you do when you come across it? Krishna Sankar is a researcher at the University of Toronto's Faculty of Medicine and with a steering committee member. She's also a steering committee member at Science Up First. Hi, thanks for being with us tonight.
Hi, thank you so much for having me.
So looking at these numbers, only 1 in 5 people check if information is accurate, and half of them share it without checking if it's accurate. Why do you think people are so quick to share information before they do any sort of, second checking?
Yeah, so people right now during this pandemic especially seem to be very quick to share information because I think, number one, people are desperate for information. They're looking to social media channels to access whatever information they can possibly get, as well as anything that's accessible language-wise, so easy to read and understand language. I think speed has a lot to do with it. Also, what I think another reason that people tend to do that is they tend to trust their sources, being friends and family, without actually thinking of double-checking the sources that their friends and family have shared this information from. And so I think both of those things actually play towards people just very quickly sharing the information that they see without fact-checking it.
You talk about things with simple languaging, and I think about, memes or photos with simple messaging on it, simple graphics. It's very shareable. What can you tell us about some of the common themes when it comes to the types of misinformation that people are sharing about COVID-19 and the pandemic?
Yeah, so some of the themes that we're seeing with people sharing misinformation, they tend to be around the vaccines, for example. So things like microchips being present in the vaccines causing infertility in women, and also the mRNA vaccines causing changes to our DNA. So that has been one huge area where we're seeing a lot of misinformation being shared. There's also misinformation about whether or not masking works, whether or not physical distancing works, and a huge array of other types of misinformation that's currently being shared as well.
So what can people do when they are reading information online, sharing information, receiving information? What should they be looking for, and how can they kind of look at these things with a more critical eye?
That's an excellent question. And so I think there are 3 main things that I think people can do in order to help themselves spot misinformation and avoid themselves from sharing it. And so number 1, I would say it's really important for people to assess the source of the information. We just spoke about the fact that a lot of people may just be resharing what their friends and families have shared online without actually looking at the source of this information. Number 2, I think it's also very important that people look at read beyond the headlines that they're seeing. So a lot of times people tend to reshare articles they've seen without actually reading the body of the actual article. They need to also assess the author. So you need to check who the author is, who's sharing this or creating and writing this content. And lastly, I'll talk about checking the dates on the article. So specifically during this pandemic, a lot of the different information coming out daily is changing. So it's what's true yesterday may not be true today.
Absolutely. I was just having a conversation with some friends about the AstraZeneca vaccine, and we were talking about that it had been banned. Someone had mentioned that it was banned in European countries, and I said, well, actually that's been updated just since yesterday. And so as you say, exactly, information changes so quickly that we have to make sure that we have the most recent or up-to-date information. What is the danger, the larger danger on our society and on the impact of us trying to curb this pandemic when this type of information is spread so widely?
So another excellent question. And I think one of the huge dangers we're actually seeing right now is towards Canadians' health and safety. If people are reading misinformation, most times it can lead to people not actually believing accurate information because they're reading misinformation, and it can lead them to not following public health advice. So for example, wearing masks. So I know that this has been contentious from the start of the pandemic, but because of a lot of misinformation, people were not wearing masks. Another really important one is a lot of the misinformation around vaccines. And because of the misinformation around vaccines, there has been lots of vaccine hesitancy. And that is something that myself and many of my colleagues are trying to fight on a regular basis.
Just on that note, this is something I brought up a couple of times with a couple of different guests. When it comes to combating misinformation with a loved one, a friend, a family member, sometimes attacking them with the science or the data doesn't seem like it does anything. What is a good approach for dealing with people who are believing and spreading misinformation?
Yeah, so I mean, I can also talk about this myself, especially with friends, and it can be very difficult, especially when speaking to loved ones, and trying to correct what it is that, the types of information that they're asking about or sharing. So I like to take the approach of kindness, and I think it's very important that we do this, not the approach of I know more than you do because I'm an expert. So first of all, especially if they share a piece of misinformation, I like to have a chat with them about it. I want to listen and learn about what their concerns are. Then I also want to validate their concerns, because nothing is worse than erasing or removing someone's experiences. And then lastly, I like to actually then take that opportunity to share a piece of accurate information that actually combats the piece of misinformation that they have shared, and go through it with them so that they can understand why one is accurate and one is not.
All right, Krishna Sankar, that's some really great information. She's a researcher at the University of Toronto's Faculty of Medicine and a steering committee member with Science Up First. Thanks so much for taking the time to chat with us.
Thank you so much.